Hi there. My name is Dr Santurri, and I have been living with interstitial cystitis or painful bladder syndrome for just about 25 years now. My symptoms started when I was a teenager. I was 14 or 15 years old. And after a few years, just after I turned 18, I was diagnosed with IC. Um, it's there's no aspect of my life that has not been shaped by living with this condition. Anything from the relationships that I've had with other people, the work that I do, and also my education. Because even though this condition has profoundly impacted me in some very negative ways, one of the other great things is that this living with this condition has made me very passionate about improving the health of other people. And so my educational background is in public health, and I specifically started to focus in on chronic disease self-management because I was especially interested in the self-management of conditions like IC that are not very well understood. Now I have an academic position in higher education. I'm a faculty member, and I maintain a research agenda in this area as well. One of my most recent studies was called the IC Hope Study, and this was where I focused on exploring the types of treatment strategies and coping strategies in IC patients that people report as working well or being effective in the treatment of their condition. And that was a really enlightening study. I learned a lot from the people who were willing to sit down and talk with me about their experiences. Importantly, though, I joined the Interstitial Cystitis Association board back in 2016. I chose to apply for the position, one, because I'm certainly very passionate about the topic, being a patient, but even more importantly, I thought that my professional background gave me a way to provide something back to the organization and to the community who I care about. And so I've been able to apply my background in both public health and in research in this area to help support the mission of the ICA and its strategic plan. Primarily, I've been working with the communications committee and have really enjoyed that. For the past year, I've also been serving in the vice chair role and have enjoyed more of a leadership role in the organization as well. And I remain just as passionate today as I've ever been. I think it is incredibly important for us to be engaged in raising awareness and providing education about this condition, because if we can do that, we can have an impact on people's health outcomes. Importantly, we can help people get diagnosed quicker and more efficiently. We might be able to help people avoid treatments that are not effective or could actually be harmful to some patients and direct them to treatment strategies that are what we call evidence-based or have some scientific background to support them. We can help people find good healthcare practitioners, people who are willing and want to treat people with this condition. And really importantly, we can help people not feel alone. This condition, I know, can be very isolating. I've experienced that myself. But I also know that when I feel safe and supported, I feel better. And I think the ICA can play a really significant role in providing that resource and benefit to the IC community. So again, I'm just as passionate as I've ever been, and I'm even more so to some extent because in October of 2022, I'm going to transition into the chair role for the ICA board. And I'm incredibly excited about being in an even higher level leadership position with this organization that I care so much about and continuing to support its mission and strategic plan.